Hi, my name is Claire Ellerbrock. I'm a nurse practitioner and I am from NP for NP's Nurtured Path for Nurse Practitioners. So today I'm going to talk about the 7 steps that need to be taken from before graduation through your first job to successfully navigate the transition into practice. There's a lot that needs to be done after you graduate from school as a nurse practitioner. Often, many of these things aren't discussed very clearly in school, and so you feel overwhelmed and unsure after you graduate. I know that I was a student who definitely had a lot of questions when I was graduating. What adds to the confusion and stress is that the timeline for various tasks is not really streamlined. There can be long delays between certain requirements as they are reviewed by outside agencies. Like when you're going to apply to be board certified, there's a lot of steps and it's easy to get lost in the delays. So, being aware of what needs to be done and by when can help you to very proactively stay on top of all of your requirements. There are generally 7 steps that need to be taken from before graduation through your first job as a nurse practitioner. We'll discuss each of these essential to dos to successfully and efficiently hit all of your requirements so that you're entering practice smoothly. So, the first step in navigating this transition into practice from NP student to NP in practice is to create a board certification study plan. In your final semester as a nurse practitioner student, you should be deciding which board certification agency you want to get board certified under. Now, you might not have an option to choose. Some nurse practitioner specialties, like psychiatric mental health nurse practitioner students, will all take the ANCC, the American Nurses Credentialing Center test, because there are no other options. But other NP specialties, like adult gerontology primary care students, can choose between the ANCC or the AANPCB, the American Academy of Nurse Practitioner Certification Board. That's a mouthful. So take the time to decide which agency you will be certified under. And if you don't have an option, know which agency you'll be required to be certified under before you graduate. After you've decided which agency you will certify under, you should create a study plan, which includes how long you want to study for and when you plan to take your board exams. If you're planning on taking a board certification prep course, map out your study plan so that you stay organized. It's really important, and it maybe sounds obvious to create a plan and know what you're getting certified under, but there's a lot of information coming at you and a lot of deadlines and a lot of delays that occur. And so having this information before you need it will help you stay on track so that you are hitting all of your requirements on time. The second step of this transition into practice involves applying for your NPI number. So many students don't know that they can obtain their NPI number, their National Provider Identifier number, while still a student. An NPI number is required for all providers in practice to obtain. And getting it while you're a student is convenient and removes one thing you need to do after you graduate from your list of to-dos. You can apply for your NPI number online, and in the article I'll attach, there'll be a link that takes you right to it so you can find it easily. NPI numbers are usually obtained within 10 days of electronic application submission, so it's a pretty fast process once you complete it. And again, there's no one specific time you should get your NPI number. You can get it a few months before graduating, right after graduation, right before you land your first job, or just after. It might be easiest to get it ahead of time so you don't forget about it, and it's one less thing that you need to do. But know that you will need an NPI number to practice as a nurse practitioner or other provider, and that it is free to obtain, which is nice because there's a lot of expenses in the transition to practice. It's nice that this is one free thing. So the first step was making sure that you're creating a plan for getting board certified. The second is applying for your NPI number. The third step in this process to transitioning into practice is applying for board certification. So applying for board certification is sort of a pain. The application process requires you to submit many different pieces of documentation, such as proof of official transcript, which is sent directly from your MSN program, showing that you've completed your program, among other documents. Now, these documents don't need to be submitted all at once, but they do need to all be submitted before the board certifying agency will review and process your application. Required documents do vary by certification agency. The ANCC, for example, requires you to submit what's called a validation of education form, that is completed by your school programs director and basically shows proof of completion of required courses. So that's step 3. That's applying for board certification. Step 4 is scheduling your exam for board certification. So after your application has been reviewed, your certifying board will permit you to schedule a test date. You want to make sure that you do this as soon as possible with your study plan in mind, because testing sites can fill up. And you want to make sure that you've accounted for your study plan and are ready to test by the time you have scheduled your test date. Next step, step 5, is applying for your state license. And so after you have passed your board exams, you will be eligible to obtain your state licensure. Now, just to provide some clarification, state licensure allows you to practice as a nurse practitioner in your particular state. Without having your NP license, you are unable to practice as a nurse practitioner. Just being board certified does not allow you to practice. It's important to remember this. The board certification process demonstrates your proficiency in a specialty, while your licensure shows that you are able to practice in a particular state. So it can take several weeks for your license to be processed, and processing time does vary by state, but this step is all about getting your license activated after you've become board certified and passed your board exam. Step 6 is applying for your DEA license. Once you have your NP license, you are eligible to apply for your DEA license. Now, a DEA license grants you the ability to prescribe controlled substances as a prescriber. Now, it's important to know that you are not required to prescribe controlled substances as a nurse practitioner. Some employers want you to have the ability to prescribe controlled substances, but know that this is a preference and it is up to you to decide if you want this license and if you want to be able to prescribe a certain class of medications. And so it's not a requirement, although some jobs may be preferential towards candidates who are able to prescribe controlled substances. So a DEA license is a federally regulated license that is renewed every 3 years. As of October 2020, the cost of a DEA license for a nurse practitioner has gone up. It's $888. The cost was increased from $731. So it has gone up quite a bit. Before October 2020, though, the fee was last increased in 2012. So not every 3-year cycle is the cost increased, but it is creeping up. So it's not a small expense, and possibly negotiating this in your job offer contract of it being covered by your future employer is a good idea, because it's an expensive license to have. So the final step is starting your first job and engaging in private supervision with an experienced clinician. So at this point, you are board certified. You have your NP license, your DEA license if you are wanting this license, and your NPI number, which you are required to have. The next steps involved are starting your first job and officially entering practice. So the journey doesn't end here, as there's a lot to learn as you enter practice. And one way to find support and feel supported once you're in the role is finding an experienced clinician to regularly review complex patient cases and answer your clinical questions. This can really help build your clinical confidence and competence. And I have a separate post I can link to that explains why all new NPs should be working with an experienced clinician for private supervision when they are entering practice. So those are the 7 essential to-dos to be aware of in your final semester of school as a nurse practitioner to successfully enter practice. So just to review those again, we want to make sure that we're first creating a board certification study plan. We then want to apply for our NPI number sometime in our final semester of school as a nurse practitioner student, or even after you graduate. You want to then apply for your board certification, submitting your application and all required documents. Then you want to, once you get notice from the certifying agency that your application has been accepted, you want to schedule your exam. After you pass your exam, you want to apply for your state license, because you can't practice as a nurse practitioner until you are granted the authority to do so by your state, and that is granted through a state license. Then you want to go ahead and apply for your DEA license, which allows you to prescribe controlled substances if you are wanting to prescribe controlled substances as a prescriber or your employer requires it. Lastly, you'll be starting your job and engaging in private supervision with an experienced physician, nurse practitioner, so that you are gaining mentorship and support in the new role. So, those are the general 7 steps that need to be taken to successfully navigate into practice. But if you want more structured guidance on everything you need to know and do to successfully transition into practice, you can check out my course on my website, npfornps.com, that takes you through a very step-by-step guidance of the landmines and pitfalls to avoid, also sample templates and guidelines to follow so that you are entering practice feeling confident and sure of yourself. I hope this helps, and I will see you next time.